In today's session, we'll just basically look at the nursing care plan for Mania. So we'll go straight into the nursing care plan. So amongst the problems that we can identify in a manic patient, the first problem that we can identify is disturbed sensory perception. Then in terms of the nursing diagnosis, we can phrase it as disturbed sensory perception related to disturbed thought process, evidenced by hallucinations, even delusions, and many others. Then in terms of the goal, you can in place of goal, someone else can say aim or objectives. So in terms of the goal, we can say patient will have improved sensory perception throughout hospitalization. Then when we talk of interventions, as usual in a nursing care plan, when writing, at least you need to come up with at least 4 interventions with rationale. So in terms of interventions, you can say I will observe the client for signs of hallucinations such as laughing or talking to themselves, so as to intervene early or to give correct interventions. Then apart from that, you can say I will advise or I will avoid touching the client before warning him or her, and this prevents the patient from reacting in an aggressive manner. Apart from that, the other point you can say I'll portray an attitude of acceptance to encourage the client to share the content of hallucinations, and this helps give proper or correct nursing interventions. Then, of course, other interventions you can talk about is avoid reinforcing hallucinations so as to prevent the patient from repetitive behaviors of repetitive psychotic behaviors. So these are some of the points that we can put among many others, including trying to distract the client away from misperception by involvement in interpersonal activities. You involve them in interpersonal activities so that they don't have those wrong perceptions or hallucinations that they tend to have. Then in terms of evaluation, of course, you can say patient's sensory perception improved throughout hospitalization, of course, evidenced by patient's ability to differentiate between reality and unrealistic events or situations. Then the next problem we can talk about is self-care deficit. So with self-care deficit, the nursing diagnosis, you can say self-care deficit related to impaired cognitive function evidenced by patient looking unkempt. Then in terms of the goal, you can say patient will have improved personal hygiene throughout hospitalization. In terms of interventions, you can say I will encourage the patient to bath and supervise the patient, of course, during birth to promote hygiene. Apart from that, you can say I will encourage the patient to wash his or her clothes when they are dirty, so as to promote personal hygiene. Apart from that, even just giving or dressing the patient in clean clothes to promote or to improve the grooming itself. Then apart from that, you can say I encourage the patient to brush their teeth after each meal to prevent oral infections like halitosis. Apart from that, you can talk about performing hair care to promote the self-esteem. You can talk about changing the soiled linen to promote comfort and prevent infections. So those and many other points, at least 4 points on interventions are enough because you get 4 marks for intervention. Then in terms of evaluation, you can say the patient's hygiene status or improved, evidenced by patient looking smart all the time. The other problem we can talk about is impaired sleeping pattern. So patients with with mania, they have insomnia. So the problem, we can phrase it as impaired sleeping pattern. And the nursing diagnosis, you can say impaired sleeping pattern related to excessive hyperactivity, evidenced by pacing in the hallway during sleeping hours. Then in terms of the goal, you can say the patient will be able to acquire 6 to 8 hours of uninterrupted sleep throughout hospitalization. And in terms of interventions, of course, you can say I'll provide a quiet environment with low level of stimuli to promote sleep. You can also observe the patient's sleeping pattern so as to give correct interventions that promotes sleep. Then apart from that, you can talk about I'll provide a structured schedule of activities, especially during the day to promote rest at night. Then apart from that, you can advise the patient to take a warm bath in the evening, as this relaxes the muscles, hence promoting rest. Or you can also talk about administering sedatives such as diazepam to patients who are having difficulties to sleep so as to promote rest. So these are some of the interventions or points that you can talk about. Then in terms of evaluation, you can say the patient's sleeping pattern improved, evidenced by the patient's ability to fall asleep within 30 minutes of retiring to bed and sleeping for 6 to 8 hours per night without medication. So that is about the third problem. The fourth problem that we can talk about is risk for imbalanced nutrition less than the body requirement. So on this particular problem, the nursing diagnosis, you can phrase it as risk for imbalanced nutrition less than the body requirement related to patients' inability to sit long enough to eat meals. Then the goal, of course, you can say patient's nutritional status will be improved throughout hospitalization. Then in terms of interventions, of course, you can say I'll provide the client with high nutritious finger meals and drinks, and to promote the nutritional status. Apart from that, you can say I will ensure that there is availability of snacks around to promote eating. Apart from that, you can give small frequent meals to promote appetite. You can also talk about serving meals in the presence of the patient to prevent suspicion, because patients who are manic, they become suspicious of anything because of the hallucinations or delusions that they are having. Then of course, you can talk about giving the patient their favorite foods or meals to promote eating. Then in terms of evaluation, you can say the patient's nutritional status improved throughout hospitalization, evidenced by patient gaining and maintaining weight during hospitalization. Then the last problem in mania that we can talk about is, of course, risk for injury to self and others. So on this problem, you can say risk for injury to self and others related to extreme hyperactivity and aggressive behavior. The goal, of course, you can say patient will be prevented from injuries to self and others throughout hospitalization. Then in terms of course, the intervention and rationale, you can say I will remove all injurious objects from the patient's room to prevent injuries. You can also talk about ensuring that the patient is placed in the seclusion room during aggressive behavior to prevent injuries to self and others, of course. Then apart from that, you can say I will ensure that the patient is placed in a straitjacket during aggressive behavior to prevent injuries to self and the others. You can also talk about administering tranquilizers such as haloperidol or chlorpromazine to relieve agitation. Then apart from that, you can also ensure that you reduce environmental stimuli that leads to aggressive behavior to prevent injuries to self and the others. So at least 4 points on intervention at least. Then we'll move on to evaluation. So on evaluation, you can say injuries prevented on the patient and on others throughout hospitalization, evidenced by patient exhibiting no physical injuries. So in terms of the nursing care plan for mania, that is how we can write. And remember, these problems can also apply in other psychotic disorders, inclusive of schizophrenia and many other psychotic disorders. So that's all for today. Till next time, goodbye.